Hi, this is Dr. Eric Westman with Adapt Your Life, and this episode is about gallbladder disease. Can you do keto without a gallbladder, and what kind of issues can arise regarding the gallbladder? First, I'd like to update you on the upcoming Adapt events. Adapt Your Life, the Adapt team will be in Tempe, Arizona, October 5th, and then North Carolina, October 12th, and then back into Texas, San Antonio, on October 19th. The Adapt events are a way to bring community leaders together with people following a keto lifestyle, facilitated by the Adapt team. Look at the ticket information down below this video. I hope to see you in one of these places for the Adapt event. When it comes to gallbladder disease, yes, you can do a keto diet without a gallbladder. There's a need for the digestion fluids from the gallbladder, but there's actually no need for the gallbladder, which is why so many people can have the gallbladder taken out and do just fine under normal dietary circumstances. The juices of the gallbladder help to digest the fat in the food, and that's why there's a lot of, I think, unnecessary concern about whether someone can do keto without a gallbladder, because the feeling is maybe the gallbladder is necessary for the proper fat digestion. But remember the juices that help with the digestion will still be there. The liver still makes those juices and allows for proper digestion even without a gallbladder. So no worries if you've had one removed. Now, some people get concerned because they have a gallstone, and so they have a gallbladder, but there's a gallstone still in place. And it is possible, if the gallbladder has not been contracting properly because of a low-fat diet for so long, it's possible that when you start eating fat, a gallbladder contraction could allow a stone to be put out into the bile duct, or where the tube goes down to the intestines from the gallbladder, and there might be a gallstone that passes. So I don't see this, I would say I rarely see it, but I've heard about it happening to people. It makes sense that if you're starting to eat fat and the gallbladder is contracting, that this might happen, a gallstone might pass. It's not that the diet is bad, it's not that the gallbladder is not necessary there. The gallstone was just there because of the prior diet, and it wasn't being expressed or pushed out of the gallbladder because there wasn't enough fat in the diet. So this is one of those circumstances where the keto diet might be blamed for the gallstone when it was there all along, and it was just eating a proper diet now, having a normal gallbladder contractions, normal function, causing the stone to be released. So it's not that the diet caused it. I mean, I suppose the proper diet did, but you want to have that kind of contraction. So a gallbladder attack is typically felt as pain in the abdomen and the upper right-hand side 1 or 2 hours after a meal. So if you do experience that, if you've had gallstones, of course, please see a doctor for that, but that's not common at all in any way. So it's okay to do a keto diet without a gallbladder. A gallstone might pass initially, but I don't treat people any differently if they've had a history of gallbladder removal or a history of gallstones. Now, sometimes if you're feeling like the fat you're eating is not being digested correctly, then of course you want to be careful to mind the fat on the keto diet, meaning don't add fats. I see a lot of people thinking that the keto diet means you have to drink ketones, or that you have to drink fats and oils and put butter on the steak and all that. No, you don't have to. You could fall back to what's commonly called the low-carb high-fat diet or low-carb keto diet without adding all of those things. And that's the experience that I have. I teach what is kind of called a lazy keto, where you don't have to add in fats, don't have to monitor macros, and my patients do fine without a gallbladder. And so if you're finding that you're following one of these keto approaches where you're adding fats in, drinking oils and butters and all that, cut that out, especially if you don't have a gallbladder, and you'll probably find that the digestion improves and you shouldn't have a problem by just eating real foods and not adding in the fat. So if you don't have a gallbladder, it's no problem. If you think you're having trouble with extra fats, don't have extra fats. Just let the fat come with the food that you eat naturally. I hope I can see you in the upcoming ADAPT events in October. We'll be in Arizona, North Carolina, and then back in Texas at the ADAPT Keto events. And look down below for the sign-ups for these programs. Till the next time.